Hi and welcome back to my channel. I hope you guys are well. Today we're going to be doing ABC. We'll be continuing with the format system of teaching. So the first question is why? So why ABC? ABC was designed to help us prioritize what to do first when we're not sure what to do, in the same way as like HHH, ABC, so hazards, hello, help, airway, breathing, circulation. Is because as you would approach a patient who's unconscious and not breathing and you'd be stressed, sometimes we are also under a lot of stress to do lots of things, and sometimes we lose track of where to start and where to end. So what we do is we go airway, which is the first A. The what question. So what is ABC? A is airway, so what it means is that we are assessing, can air move from outside in the environment, in the atmosphere around the patient, through their mouth, through their trachea into their lungs, and can it move out? So that's airway, because there's movement of air that needs to happen. Then is breathing. Is the patient breathing? Because someone can be breathing and not have any air movement. And then the last question is C, which is circulation, is to see whether there is a pulse. That might be feeling for a pulse, that might be seeing if the patient has good color. These are all indications that the patient has a pulse. So airway is air moving in and out, or can it move in and out? Because if the tongue falls back, the airway is blocked. Or if they're choking, the airway is blocked. Breathing, is the patient actually breathing? Is it enough breathing? Are they breathing too slow, too fast? And then C is circulation or color. Do they have good color? Do they have a pulse? Pulses can be difficult to feel, but also remember, if a patient is breathing, they have a pulse. So the how. You assess the airway and breathing kind of in the same time. You can put your ear close to their mouth or their ear, and you can feel air, or you can hear air coming up or out of their nose and their mouth. By in the same time, you can see rise and fall of the chest. You might have a scenario where the airway is blocked, but the patient is breathing, in which case you'll see chest rise, but you'll hear and feel no air coming out. So the way you would open an airway, if you're seeing the chest rise and no airway movement, you just tilt the head back and the chin up, and that opens the airway. For instance, if you look up at the ceiling and you try and swallow, if you do it now, it's very challenging to do, because it pulls your tongue away from the back of your throat, and that makes it challenging, and it opens up the airway, which is what we're wanting to do, and then you'll see air move. So the C is circulation. You can assess circulation by feeling for a pulse. That can be done in the neck. It can also be done on the arm. Quite difficult to feel sometimes. Another way to do it is to, if the patient is breathing, they have a pulse. So what you can do is you can check cap refill time, or the time it takes for blood to move back into the finger rather. So if you squeeze the finger for about 5 seconds and you let go, you see it turns from pale to red again. So that's showing that there is enough blood pressure to even get blood supply to the finger, which we're then going to say that there is enough blood supply to get blood to the kidneys and the lungs and the heart and the brain, all those vital organs. So the if question. If a friend or family or someone you come across is lying on the ground and they're unconscious, you can approach them and just remember hazards, hello, help. Once you've done that, you assess their airway and breathing at the same time. So you put your ear close to their nose and their mouth, and you're going to listen and feel for breathing. And while you're doing that, you're looking for chest rise. If there is chest rise and there's no air coming out of the nose or the mouth, you can tilt the head back, and that'll open up the airway. It's very effective. It's a head tilt chin lift. And so if there's no breathing, so there's no chest rise, and there is no air moving coming out of the nose or the mouth, then they're not breathing and there's no pulse, and you need to start CPR. That is another video that I'll be making. It will discuss all of those things like that. And then if the patient is breathing and there is movement of air and the chest is rising and fall, they all have a pulse. And if they have a pulse, you can assess it, but there's no real need to assess it. But what you can look at is color. Are they well perfused? Are they pink? And yeah, I hope that's really helpful. If you've enjoyed this, please like and share the video. I will have a Google test down at the bottom, which you're welcome to do. I don't need your names or your numbers or your personal details. It's purely there to help you take what you've learned here and put that into practice.